Hello and welcome to this podcast brought to you by the Isle of Man Anti-Cancer Association. My name is Sandy. I am the Executive Officer of the Isle of Man Anti-Cancer Association and a cancer survivor.
And my name is Malcolm. I'm Chairman of the Isle of Man Anti-Cancer Association and a former surgeon. In this podcast we want to talk about ovarian cancer. Ovarian cancer is often termed the silent killer for the very reason that it can give rise to very few symptoms in the early stages of the disease, and in some individuals be widely spread before they are aware that there is anything amiss.
Many of you may well remember Diane Oxberry, a well-loved and respected broadcaster and weather presenter for North West Tonight, who died within months of being diagnosed with ovarian cancer. Her relatives have set up a charity to promote awareness of the disease to help others in the future.
To understand why this disease may seem to suddenly arise out of the blue, it is important to appreciate where the ovaries lie. Each lady has two ovaries as part of the female reproductive system, one on each side, deep within the pelvis. This affords the ovaries an element of protection from external injury, and during pregnancy, protection of the young fetus. As the tumour develops and enlarges, it takes up more space within the pelvis, and just like in early pregnancy, there is little external sign of what is going on internally. The ovaries do lie close to the bowel and bladder, so subtle changes related to the performance of these organs may be an early indication that all is not well.
The good news about ovarian cancer is that 90% of women diagnosed with early stage ovarian cancer will survive over 5 years. It is therefore important to be aware of the signs and symptoms of early ovarian cancer and ways to reduce your risk of developing the disease. Ovarian cancer is the 5th most common cancer in women behind breast, lung, bowel and womb cancer. It affects around 7,000 women in the UK each year, so that's around 5 to 6 women on the Isle of Man. This equates to just over 1 in 50 women in their lifetime. Rare forms of ovarian cancer can occur in early life, but the incidence rises sharply from 35 years of age onwards, reaching a peak in the early 80s. 3/4 of cases occur in women over 55 years of age.
Ovarian cancer occurs when abnormal cells within an ovary start to multiply, creating a tumour. Tumours may be non-cancerous, meaning that they don't spread to other parts of the body. Such benign tumours are rarely life-threatening, but may still require treatment. However, malignant ovarian tumours are cancerous and can be life-threatening, which is why it is important to be aware of the symptoms that the disease might produce. As we have said, the symptoms of ovarian cancer can be quite vague and consist of persistent stomach pain, persistent bloating or increased stomach size, difficulty eating or feeling full quite quickly, needing to pass urine more frequently, and occasionally other symptoms may include back pain, changes in bowel habit, either diarrhea or constipation, or feeling fatigued or tired all the time.
Many women might experience a number of these symptoms from time to time associated with a number of less worrying conditions, such as IBS, ovarian cysts, or polycystic ovary syndrome. Ovarian Cancer Action, one of our partner organisations, say that there are a number of key factors to be aware of. Their persistence. In ovarian cancer, they don't go away. Their frequency. They occur on most days. They are new, so they started in the last 12 months, or they are unusual, so they're not normal for you. NICE guidelines to GPs emphasis investigation if the symptoms are persistent or occur at least 12 times in a month. Ovarian Cancer Action advise keeping a diary of your symptoms over a few weeks to take to your GP. A copy of their symptom diary is available from Ovarian Cancer Action website, which is ovarian.org.uk, or the Macmillan Cancer Information Centre at Nobles Hospital. Remember, it's very important to go and see your GP if you are concerned.
There are a number of risk factors that we know can increase the chances of someone developing ovarian cancer. These are very similar to those of breast cancer. Both diseases are probably related to prolonged exposure to the female hormone estrogen. So, if your periods started before the age of 12, if you reached the menopause after the age of 55, had no pregnancies or a first child after 30, something that is a little worrying in this day and age when women are choosing to delay having children, or having not breastfed, each of these factors slightly enhances your risk of developing the disease. Use of HRT is also a risk factor through the same mechanism. For every 1,000 women taking HRT for 5 years from the age of 50, there is an additional one case of ovarian cancer. HRT is appropriate treatment for certain symptoms experienced by some women, but treatment needs to be tailored to individuals and regularly reviewed as to whether the time has come to stop it. Smoking and obesity are also important factors, and stopping smoking and weight reduction can reduce your risk. 1 in 10 ovarian cancers are caused by an inherited faulty gene, such as BRCA1 or BRCA2. So women who have 2 or more relatives on the same side of the family with either breast or ovarian cancer may have inherited such a gene. If so, you need to discuss this with your GP and possibly be referred to a specialist clinic.
At the moment, there is no national screening for ovarian cancer. Some women think that going for a smear test means that they are checked for ovarian cancer, but this is not the case. A smear test looks for cervical cancer, which is a tumour of the neck of the womb, and not ovarian cancer. There is a tumour marker that can be detected in a blood test, but it isn't sufficiently specific for ovarian cancer. The good news is that over the past 40 years, the chances of women surviving ovarian cancer has doubled, and in many ladies these days, even if the disease is not curable, it can be controlled for many years. With more research, even better treatments will emerge and possibly a screening test.
In the meantime, results are best if the disease is diagnosed at its earliest stages. So let's recap what symptoms might be an early indication of ovarian cancer. The 4 main symptoms of ovarian cancer are persistent stomach pain, persistent bloating or increased stomach size, difficulty eating or feeling full quickly, needing to pass urine more frequently, with occasional other symptoms including back pain, changes in bowel habit, either diarrhea or constipation, or feeling fatigued or tired all the time.
For those who want more information on ovarian cancer, Ovarian Cancer Action has a very informative website, ovarian.org.uk, or you can visit the Macmillan Cancer Information Centre at Nobles Hospital or contact them on 650 735 or look at their website, which is macmillan.org.uk. Thank you so much for listening.